Shenaaz, you have been working in this area for a long time, and with the helpline that your heavy involvement with the helpline. So, what do you think is the most helpful for people in distress, especially when we are talking about this kind of an anxiety that is coming up, and the long sadness that follows after that, along with certain guilt that, like Dr. Avinash said, that I was not able to do enough, basically. So, what is your experience on that? Shenaaz, you're on mute.
Sonali. So obviously the first symptom that you see in any person is distress. The distress could be in any form. They could show it verbally, non-verbally. I think the most important thing for any person to support a person in distress is to listen. Is to listen actively without any judgment, without patronizing that person. You know, calmly listen to the person, vent out his feelings, vent out his thoughts. Very often we have found that just talking it out, venting it all out, helps a person slowly calm down.
Right.
Very often, you have this whole myth about you should not ask about the word suicide. Do not use the word suicide because you will put that thought into that person's mind.
Absolutely.
On the contrary, if that person is already thinking about suicide, you're asking that question directly to that person. Gives that person the support that it is okay to talk about it. It is not a taboo subject. And that I, as a person, when I'm asking you about suicide, I'm comfortable listening to your answers.
Right.
So, acknowledging that person's thoughts, emotions, feelings the way they are, without giving any advice, without being judgmental, I think is the most important thing initially to help a person in distress. Very often you hear some family member or a colleague or a friend or turn around and say, अरे तू इतना सोच मत, कुछ नहीं है, भूल जा, you be strong, nothing will happen. This
Right.
actually increases the distress of the person.
Hmm.
So once you are able to alleviate the distress to an extent, it will also help then to guide that person to a mental health professional.
Right.
As Dr. Avinash mentioned, as Dr. Wilona mentioned, there is a lot of other factors involved. There
Absolutely.
may be a hereditary factor, there are the environmental factors, which at least needs a screening from a qualified mental health profession.
Absolutely. Absolutely. So Shana, just a sub question to that. Like, we just spoke about, it being a patriarchal kind of a family. So, at what point do you think that, it becomes a little challenge, right? You cannot push the patient or, the family to a very large extent. And then you have to say, okay, I back off at this point. So, what is the level of information that you leave with them, so that they at least consider it at some point?
I think very factual information.
Mm-hmm.
So again, there is a lot of stigma attached to mental health issues.
Right.
You know, educated, uneducated, across socio-economic strata, there is a lot of myths. There is a lot of stigma. Families don't want if somebody is suffering from any kind of a mental health issue that it should. It's a taboo. You don't want it coming out of the four walls of the house.
Absolutely.
So educating the family and friends is very important. For a counselor, I think that also becomes a major part of suicide prevention strategy.
Right. Right. Okay.
And
Okay.
explaining, very often when a person is distressed, uh, you have a family member or a friend or saying, अरे वो ऐसी है, she's just attention seeking. या शी इज वो क्राई बेबी है और जब देखो ऐसे ही रोती रहती है.
Right, right, right.
But
Totally.
it may be signs of a more intense or a severe mental health issue. So
Absolutely.
educating them about it, that it like a physical illness. When you seek a doctor, you don't think twice about seeking help for a physical illness, for a physical ailment.
Right.
बुखार है, पेट में दर्द है, तो आप डॉक्टर के पास जाते हो. Similarly, for mental health issues also, you can approach for help from a
Absolutely.
qualified professional.
Absolutely. Absolutely. Thank you so much, Emma.
Sonali, I want to highlight something that Shenaaz ma'am said, that it is important not to shy away from asking the question about suicide, right? I think in my experience, at least 80 to 90% of the times I've asked that question, the answer has been yes.
Hmm.
And the
That.
family members and friends and everybody are looking at us ki kuch mat bolo, but we know that if we don't ask that question,
Right.
then it doesn't help us diagnose, or it doesn't help us make it clear to the patient and family how serious the problem is, right?
Correct.